The need to care for, nurture, and protect our children is hardwired into our being. It is a natural extension of what it means to be human. It makes us human. And for some, this basic need has been denied. For some, the chance of fulfilling a basic need was all but a dream. But we've come a long way in medicine, where once there was only the incurable, now there is hope. And MedFem is at the forefront of this hope. Our procedures and techniques have contributed to there being a bit more laughter in the world. The right kind of laughter. Allow us to explain how we can bring that laughter into your world. IVF or in vitro fertilization and ET or embryo transfer are techniques which are used for a variety of infertility problems, particularly for male factor problems, endometriosis, advanced maternal age, or when the female partner has blocked or damaged fallopian tubes. There are 5 stages in the procedure: medication, monitoring, egg retrieval, laboratory, and waiting stage. First, the medication stage. 2 types of medication are used during this stage. Leucrin is a small daily injection which is begun on the 21st day of the previous cycle and is continued up until the eggs are retrieved. Leucrin has 2 functions. It suppresses the release of the body's hormones and prevents early ovulation. In the long course protocol, these injections given in high doses commence after the onset of menstruation. The allocated days of injection are flexible and are given for 5 days before the monitoring commences. The function of these injections is to stimulate the ovaries to develop multiple follicles. In the short course protocol, the egg stimulation injections begin on day 3 of the cycle and monitoring commences on day 8. This particular protocol is not flexible. We now move on to the monitoring stage. After 5 days of hormone injections, ultrasound scans are performed to determine the number of follicles and their size. Not all follicles contain eggs, and the size of the follicle determines the maturity of the eggs. Usually, the follicles are small at the first scan. Subsequent scans and hormone injections will continue until the leading follicle reaches 18 millimeters or more in size. An ovulation injection, overdrill, is usually given at a specific time in the evening. Egg retrieval will then take place 36 hours after the ovulation injection, this being a good 8 hours before the egg is due to be released from the ovary. The third stage, or egg retrieval stage, lasts only 15 to 20 minutes and is performed while the patient is under sedation. The follicular fluid in which the egg is suspended is methodically drained into a test tube, and this is done with each follicle. The fourth stage is the laboratory stage. A laboratory scientist using a high-powered microscope identifies the eggs immersed in the follicular fluid. The eggs are then placed into a dish which contains a highly specialized growth medium. The medium allows the eggs and later embryos to continue developing as they would in the fallopian tubes. The sperm sample is collected, prepared, and placed in the medium with the eggs. The dish with eggs and sperm are placed in an incubator, and fertilization then occurs naturally. The embryo transfer is performed 3 to 5 days after aspiration. Our laboratory scientists who have been monitoring embryo development closely will know which embryos to replace into the uterus. Your doctor will discuss with you which and how many of the embryos are to be replaced at this stage. A more accurate estimation of the success rate for the treatment will also be covered. The embryo transfer is a minor procedure requiring no sedation. Finally, we enter the waiting stage. Extra medication is given to maintain a healthy lining. Emotionally, this can be a very taxing time. Hormone levels are high and there is not much which can be done to influence the outcome of the treatment. Whether there is a pregnancy is determined soon after the embryo transfer, and the patient is advised to resume normal activities in this period. The pregnancy test is done 2 weeks after the embryo transfer. Medications that were prescribed at the time of embryo transfer. If there is no pregnancy, it is important to communicate with your doctor. Even though it will be extremely disappointing, remember that your doctor has gained valuable diagnostic information throughout the procedure that will guide him in planning future treatment. Intracytoplasmic sperm injection, or ICSI, involves the micro-injection of a single sperm into an oocyte. ICSI is regarded as one of the major breakthroughs in the treatment of male infertility, since only a few normal sperm are needed for conception. Men who were previously seen as completely sterile now have an excellent chance to have their own child. The actual treatment is the same as the 5 stages in vitro fertilization. The only difference is that in the laboratory stage, sperm is not placed with the egg, but is injected into the actual egg during highly intricate and skilled lab work. A special microscope called a micromanipulator is used by the lab scientist to perform the procedure. Let's discuss embryo freezing after assisted reproduction procedures, or blastocyst vitrification. Cryopreservation is used in infertility programs mainly to freeze and store embryos from an assisted reproductive cycle. We are currently using the vitrification technique for blastocyst freezing. Vitrification is an ultra-rapid method used to freeze blastocysts instead of the traditional slow freezing process. Simply put, vitrification is the process of converting fluid or matter into a glass-like solid that is free of any crystal formation. This yields better post-thaw survival rates and higher pregnancy and live birth rates from frozen embryo transfer cycles. Some blastocysts may not survive the freezing process, but this is related to the quality of the blastocyst itself. Incubation. The blastocysts are warmed on the equivalent of day 5 in either a natural or controlled cycle and transferred after an incubation period of 4 to 6 hours. A mere 2 hours after warming, the viability of the blastocysts can be identified and pregnancy testing is performed 10 to 12 days later. Embryo, biopsy and genetic testing. For patients with advanced maternal age, recurrent miscarriages or other genetic concerns, MedFem offers the option of embryo biopsy and genetic testing. Conclusion. The processes we have just described may sound complicated and very technical. Well, they are. But you're in the hands of consummate professionals. Professionals who care. All that remains to be said is that there is hope. That the chances are good that your home could be filled with noise and laughter. The kind of laughter that makes life worth living. MedFem.